Warning signs of breast cancer. Breast cancer is by far the most common form of cancer in women. In the USA, 1 out of 8 women will develop breast cancer in their lifetime. The cells in the breast start growing out of control, which becomes cancerous. The kind of breast cancer depends on which cells in the breast multiply and turn into cancer. A breast is composed of 3 major components: lobules, ducts, and connective tissue. The lobules are the milk-producing gland. Ducts are the tubes that transport milk to the nipple. The connective tissue, which is fibrous and fatty, surrounds and holds everything together. The majority of breast cancers start in the ducts or lobules. Breast cancer can spread outside the breast via blood and lymph vessels. Breast cancer is said to have metastasized when it spreads to other parts of the body. Breast cancer symptoms can vary from person to person. Unfortunately, most people do not detect any indicators at all. A lump in your breast or armpit is the most common symptom. Skin changes, soreness, a nipple that pushes inward, and unusual discharge from your nipple are among other symptoms. A painless lump in the breast is usually the first sign of breast cancer, even if you're not aware of it. A routine screening mammogram detects many lumps. The shocking fact is that most women have no visible signs of breast cancer at the time of diagnosis. In the early stages of breast cancer, the tumor is rarely visible to the naked eye or touch. That is why a mammogram is so important. Breast cancer types and symptoms. There are several different kinds of breast cancer. Many of them share symptoms. Symptoms of ductal carcinoma. This type of breast cancer is the most common. It all starts with your ducts. 1 out of every 5 new cases of breast cancer is ductal carcinoma. This means you have cancer in the cells that line your ducts, but hasn't spread to the surrounding tissue. There may be no symptoms of ductal carcinoma. It can also result in a lump in the breast or bloody discharge. Symptoms of Paget's disease of the breast. This type of cancer is frequently associated with ductal carcinoma. It has an impact on the skin of your nipple and areola. Symptoms resembling eczema include crusty, red nipple skin with discharge that is either bloody or yellow, a nipple that is flat or inverted with an itching or burning sensation. Symptoms of lobular carcinoma. This type begins in the milk-producing glands known as lobules. It is the second most common type of breast cancer after ductal carcinoma. Lobular carcinoma is asymptomatic and unfortunately cannot be detected with a mammogram. This is typically discovered during a breast biopsy. The breast may appear flat and have inward meaning inverted nipples. One side may feel full and thick. There may be swelling as well. Symptoms of metastatic breast cancer. Breast cancer can spread to other parts of your body, including other organs, if not treated. This condition is known as metastatic, advanced, or secondary breast cancer. Depending on where you are, you might have bone ache, headache, brain function changes, having difficulty breathing, swelling of the abdomen, skin or eyes that are yellow, dual vision, nausea, appetite loss, and weight loss. Symptoms of triple-negative breast cancer. Breast cancer is classified as triple-negative if it lacks receptors for the hormones estrogen and progesterone and produces insufficient amounts of a protein known as HER2. This type grows and spreads faster than others, so doctors treat it differently. Triple-negative tumors account for 10 to 15% of all breast cancers. They cause the same symptoms as other common types. Inflammatory breast cancer is a rare type that mimics the symptoms of an infection. Inflammatory breast cancer doesn't always cause breast lumps and may not appear on a mammogram. As a result, inflammatory breast cancer may be missed by a self-breast exam, clinical breast exam, or even a mammogram. Inflammatory breast cancer may also be missed by ultrasound. The changes to the surface of the breast caused by inflammatory breast cancer, on the other hand, can be seen with the naked eye. Inflammatory breast cancer symptoms can appear quickly, and the disease can progress quickly. Any sudden changes in the texture or appearance of the breast should be immediately reported to your doctor, which are breast that is red, swollen, itchy, and tender to the touch. The surface of the breast may become rigid or pitted, similar to an orange peel. The breast feels heavier and enlarged with a burning or aching sensation. The nipple becomes inverted. Lymph nodes under the arm and above the collarbone are swollen. Symptoms do not subside even after an antibiotic course. Symptoms of papillary carcinoma. Although papillary carcinoma may not be present, its development may be detected by a routine mammogram. Papillary carcinoma is most commonly diagnosed as a cyst or a lump, measuring 2 centimeters to 3 centimeters in size, which can be felt with the hand during a breast self-exam accompanied with a bloody nipple discharge. Symptoms of angiosarcoma. Angiosarcomas account for less than 2% of all breast cancers, these being in the cells that line the walls of your blood vessels or lymph nodes. Angiosarcoma can result in a growth in your breast, a bruise-like purple spot on the skin when scratched scratched or bumped, the skin bleeds easily, or one-sided discomfort. Symptoms of male breast cancer. Men account for about 1% of all breast cancer cases. Because it's so uncommon, you may not notice the symptoms until cancer has spread. Keep an eye out for breast lumps that are usually painless, breast enlargement, dimpling, puckering, and redness of the nipple or breast skin, fluid discharge from the nipples. Diagnosis of breast cancer. Breast exam. It may be difficult to select the treatment that is best for you. Consult your cancer specialist about treatment options available for your cancer type and stage. Your doctor can explain the risks and benefits of each treatment, as well as any side effects. Mammogram. A mammogram is an X-ray of the breast. If an abnormality is detected on a screening mammogram, your doctor may recommend a diagnostic mammogram to further evaluate that abnormality. Breast ultrasound. Ultrasound imaging creates images of structures deep within the body by using sound waves. A new breast lump can be scanned with an ultrasound to determine whether it's a solid mass or a fluid-filled cyst. Removing a sample of breast cells for testing, or biopsy. Breast cancer can only be diagnosed definitively through a biopsy. During a biopsy, your doctor will extract a core of tissue from the suspicious area using a specialized needle device. Often, a small metal marker is left at the site within your breast to help future imaging tests identify the area. Biopsy samples are sent to a laboratory for testing to determine whether the cells are cancerous. A biopsy sample is also analyzed to determine the type of cells involved in the breast cancer, cancer's aggressiveness meaning its stage, and whether the cancer cells have hormone receptors or other receptors that may influence your treatment options. Breast magnetic resonance imaging, or MRI. An MRI machine creates images of the interior of your breast. An MRI, unlike other types of imaging tests, does not use radiation to create images. Treatment of breast cancer. Choosing the best treatment for you can be difficult. Speak with your cancer doctor about the treatment options available for your cancer type and stage. Your doctor can go over the risks and benefits of each treatment, as well as the side effects. Surgery. An operation in which doctors remove cancerous tissue. Chemotherapy. Special medications are used to shrink or kill cancer cells. The drugs can be pills that you take or medicines that are injected into your veins, or both. Hormone replacement therapy prevents cancer cells from receiving the hormones they require to grow. Biological treatment helps your body's immune system fight cancer cells or control side effects from other cancer treatments. Radiation treatment. High-energy rays, similar to X-rays, are used to kill cancer cells. If you enjoyed our video, give us a like and keep watching your screen for more content.